Welcome everybody. It's with tremendous pleasure that I welcome you all on behalf of Yoopha to Healthtech Forum 2020. Yoopha Healthtech began with a motto to assist entrepreneurs to do better business by applying a domain expertise. Our vision is to exceed expectations within the service delivery. We are a pioneer and are instrumental in bringing a streamlined process to the market and amplify our clients' existence with the digital world. We're well positioned and equipped with partner with healthcare organization with constant re-engineering and being accessible to changing client needs. So as we fight this pandemic, this forum by Yoopha titled Where We Are and How Best We Can Improve is in best efforts to call for the experts in the field and gain their expertise in handling it in this tech-driven world. We've gathered here to strategize with our esteemed panelists who are the very best in their fields. This forum will indeed leave behind thought-provoking statements and captivating solutions in the sands of time. On this note, we're excited to welcome Dr. Priscilla Dhanaraj, CEO Education of SetMaps, a moderator for the first panel discussion on current challenges and roadblocks in healthcare industry due to COVID-19 and social distancing norms. Dr. Priscilla has sound knowledge and exposure in clinical research with over a decade of experience in training and development and dentistry. She's a confident healthcare professional with a long track record of successfully diagnosing and treating patients and their dental conditions. At SetMaps, Dr. Priscilla heads the education and the Department of Psychology, where she's overseeing the analysis, screening, and counseling divisions. Over to Dr. Priscilla.
Good evening and welcome to one and all. Thank you, Aishwarya, for that introduction, and Earl Justin Robert for entrusting me with this responsibility. And congratulations to the Yoopha team on the Yoopha Healthtech Forum 2020. Current challenges and roadblocks. Healthcare professionals choose careers in their respected fields, knowing it would be a challenge. We knew we would face inordinate risks, but this does not mean we become immune to what we face. It just means we think taking care of patients is worth the exposure, and we trust our courage and cope with the impacts. On this note, I would like to go further down and invite the esteemed speakers who have taken their time during their hectic schedule, to be here with us and share their views. Welcome Dr. Fabiola Mathew, Professor, Assistant Professor Ayappan, Dr. Vivekanand, and Dr. Akila Ayappan. Thank you for being here with us. Thanks, the esteemed member of profession and the Scientific Management 2015, Women's Education Achievement Award in 2014. She would speak to us today on frontline warriors, pleas, and their challenges. Over to Dr. Fabiola.
Good evening to everybody. I hope I'm audible to everybody. Yes? Okay. I'm Dr. Fabiola. Thank you for giving me a good introduction, Dr. Priscilla, and greetings to all the panel members. At the outset, I would like to thank Yoopha for giving me an opportunity to be a part of this program. It gives me immense pleasure to talk about the pleas and challenges of the frontline workers, the most important part of today's issue. Who are the frontline workers? Basically, the frontline workers are the doctors, the nurses, lab technician, other technician, and the janitors at the bedside 24/7. So I would like to briefly share 5 challenges which the healthcare workers are facing in today's scenario. The first one, as India is fighting COVID-19 crisis with a nationwide lockdown, The healthcare workers are basically working day and night to minimize the damage due to the COVID-19 virus. As you have seen, all the doctors and nurses throughout, the health workers also in the media, every day it's projected. They are on and off, and sometimes they are at a stretch in the hospital. That's the second point which I would like to say. The threat of the healthcare workers catching the coronavirus and infecting themselves and their families also loom at a large. Because of this, the doctors and nurses are given up going home and are given solitary accommodations in the healthcare facilities where they reside over for weeks and months together taking care of the COVID-19 patients. The third most important challenge is the disease is very contagious. Until now, we do not have any concrete solutions on how to manage it effectively here or abroad or globally, anywhere. So this becomes another challenge where the healthcare workers or the frontline warriors are constantly with the patient 24/7 and take care of the patients with a lot of fear and anxiety if they're going to contract the disease, or and you can understand like they may have the fear of death also. The fourth important thing is the usage of PPE. So what is this PPE? PPE is basically personal protective equipments, which are the gloves, mask, eye care, apron, and the shoes, which is an essential gear for the healthcare workers to work to protect themselves from the harmful biological agents and the contaminated surfaces. It is also said that wearing these PPEs at a stretch, that is for 6 to 2 hours, are very agonizing, and we have seen doctors and nurses stating that over the 6 or 7 hours when they are using these PPEs, they have problems going to the toilets, or even taking a glass of water, or even taking a snack would be very difficult. The second issue when they are using a PPE is discarding the PPE. Again, discarding the PPE should be done very carefully. If it is not removed and discarded properly, they can contract the infection again. But on the contrary, wearing the PPE is definitely assures safety for the healthcare workers. The main and the last important thing is looking into their psychological or mental well-being. I would like to state over here a study which was done in China among 1,300 health workers, who are all the frontline workers. And the study revealed that most of the health workers suffered with symptoms of depression, insomnia, and distress. The workers had a heightened risk of psychological distress, and others had mental problems due to increasing number of COVID cases every day, and overwhelming workloads and information overload and insufficient PPEs and drugs. The study also added that the health workers even faced stigmatization as well as fear of infection for themselves and their families. The demographic variable showed that the majority of the participants were females, that is 76%, in the age group of 26 to 40 years, out of which 60% were nurses, 39% were doctors, and the other health workers were 41.5%. The results are an eye-opener to show how the health workers are mentally strained and struggling. At this point, I would like to take an opportunity to talk about the nurses, who are the largest group of healthcare facility workers in any healthcare facilities, and are the backbone of any healthcare setting. WHO, that is the World Health Organization, has declared this year, that is 2020, as the year of the nurses and the midwives, with the theme Nursing the World to Health. Nurses Day is celebrated every year on the 12th of May, denoting the birth anniversary of the founder of the modern nursing, that is Florence Nightingale. And this year is very special because it's the 200th birth anniversary of Florence Nightingale. You must be thinking why I'm talking about Florence Nightingale. It's important during this period because one important highlight about her achievement is during 1954, during the Crimean War, she and around 38 nurses, along with her, during the Crimean War, took care of the wounded soldiers who are struggling and were in very bad condition. And the wards and the other, the environment was very bad. Sanitation was very poor. She mainly emphasized on sanitation and keeping the wards meticulously to keep the environment clean and tidy. And surprisingly, 4 months, the death rate in this particular hospital, Barak Hospital, came down to 40%, which was very surprising for the doctors who were also treating. So she brought out a book on hand sanitization, hand hygiene. So I think this story is very applicable right now because her remarkable achievement is practiced till date and more during this COVID period pandemic. I'm sure everybody would agree with that on hand sanitation, which was hand sanitation, which was brought about by Florence Nightingale. Finally, even though reports and news are pouring about our healthcare workers being attacked or asked to vacate their rented accommodation everywhere globally, the healthcare workers take the pride of serving the country during this time of crisis. Even during such critical situations, the doctors, nurses, technicians, other technicians and janitors are a big pillar of moral support for the patients, COVID patients who are already admitted in the ward, and help them out throughout the period of recovery. And you will see in the media on and off, when a patient or patients are recovering and going out of the hospital, the nurses and doctors send off the patient with a big applause and a smile. I think we should really salute the front care workers. Therefore, let me conclude by saying that success in any healthcare workers comes only by hard work, persistent, late nights, rejection, sacrifices, discipline, criticism, doubts, failures, and risk. So let me conclude by stating that we need to salute and be grateful for the people who make us happy. The best way to thank the healthcare workers globally is to pray for them and not to hurt them. Thank you.
Thank you, Dr. Fabiola. I'd like you to answer a few questions for me on your talk. What are the setbacks for the frontline workers? Could you brief us in short?
This is a very apt question. As you can see in the media, most of the healthcare professions who are on the front line are being stigmatized, telling that they have COVID. They show it in the news and other media. I think everybody must be watching that. That is the biggest thing, stigmatizing them, telling that they have COVID-19 infection. The second is house owners refusing to give them accommodation and telling them to vacate the flats. The third thing is important. The most important thing is improper diet. Even a few days ago, we saw a nurse who fainted, and when they found out that the reason for why she fainted, she was dehydrated. So I think all these things are really big issues where the healthcare workers are facing, and of course psychological breakdown, missing their families, and the families missing them. And emotional exhaustion can be seen in the space in these people. And throughout the day, you can see news of new cases of healthcare workers developing the COVID-19 infection and getting admitted, nurses, doctors, and other people. And the most painful thing, I think everybody would have seen in the news, when a healthcare worker is dead, even a place to bury the patient is not given. A biggest example, I think people from Chennai may know Dr. Simon, who was a neurosurgeon, famous neurosurgeon. He was not given a place to be buried. It's very pathetic. So these are the main setbacks which the present frontline workers are facing.
The next question to you, doctor, is what are the threats on a daily basis, like availing of PPE?
Coming back to PPE again, of course, using the PPE continuously, that is the personal protective equipments, they have to use it at a stretch for 8 hours. And 8 hours, it's not a joke. An apron, a mask, a goggle, gloves, and everything. It's very difficult, and many of the doctors have also stated that they use diapers. Going to the toilet or taking a drink or taking a food is very difficult for them. And then overload of work continuous admissions, which is very pathetic. COVID patients continuously getting admitted, fear of contracting the disease and facing death. That is the biggest thing. And managing patients' relatives, being a big psychological support to them. And if there is no proper PPE given for healthcare workers, we all know, many of us are there from the health sector, the rate of getting the infection becomes 3 times more than a regular person. So that is a few issue. And one good thing that the government of India has stated that they've started making PPE at a rate of 2 lakhs every day. So most probably there should be sufficient PPE for all the people. And even today's Hindu newspaper, if you would have read, there was a medical assistant who had contracted the disease because there was no sufficient PPE in that particular health setting. And he's admitted, and family members, one of his daughter has written that there is no health, there are a lot of COVID patients admitted in that particular hospital and no proper PPE is given. So that is a main threat for all the health workers right now when they go to the wards on an everyday basis.
Okay, thank you, doctor. In short, can you please explain to us what would be your advice for the frontline workers and to maintain their psychological fitness?
Looking into the psychological fitness, that is the biggest issue I think frontline workers are facing. Like I told you, the study in China, many of them had faced a lot of mental exhaustion, depression, anxiety. I think it's the same thing in here also, where they are lacking PP and other things. It's very important for them to have a positive attitude. First thing mainly is proper sleep. At least a minimum of 7 to 8 hours of sleep is needed for the healthcare workers. Some meditation, some prayer every day, and being hydrated is very important. The more hydrated you are, we can throw off all the serotonin and dopamine, which causes anxiety and depression. 2 glasses of water really pushes up your mood. So it's important that healthcare workers are hydrated well, a proper diet rich in iron, zinc, vitamin C, amino acids are very important, on and off, of course. And then tuning themselves and feeling that this is a passing episode. Of course, we have seen in the newspapers again and the media stating that by October or so, the malls and the theaters are going to open. So with this positive thought, I think health workers can tune themselves so that they can come out properly from all these issues. And another important thing I would state over here is to boost their psychological or mental state. They can periodically talk to their families through video calls or conferencing, or there are a lot of social media now. So those can also boost the health workers definitely. And the last important thing is, if they're really traumatized or over-exhausted, definitely an appointment with a psychiatrist or psychologist will be very useful so that they can come over it. They should not just stay back with this stressfulness. So an appointment with them would definitely help these health workers to overcome that. I hope I answered your question.
Yes, you did. Yes, you did. Thank you. We'll want to our next speaker, that is Dr. Ayyappan. He's an associate professor, Dr. M.K. Ayyappan, M.S., M.C.H., F.R.C.S., Edinburgh, UK, vascular surgeon, holding an advanced fellowship from Queen Elizabeth's Hospital, Birmingham, UK. He's a renowned vascular surgeon and an associate professor for the past 20 years and has experience in the field of medical practice and endovascular surgery. He has performed ample number of successful minor and major endovascular surgeries and held the chair as the chairman of the Chennai Vascular Welfare Society 2016-2018. Dr. Ayyappan would talk to us on OT protocols during the pandemic.
Good evening. I hope I'm audible.
You're audible.
Hi. Thank you, Yoopha Healthcare, for this opportunity. I thank Dr. Priscilla for inviting me and Dr. Akila. I'll keep my talk very brief. Is the screen not visible?
Yes.
Yeah, it is.
So, just basic details about coronavirus. So, it's called COVID-19 or nCoV. It's a single stranded RNA virus of the SARS-CoV virus group and closely resembles two bat-derived SARS-like virus. And human to human spread is by contact, droplets, or fomites. Fomites means your towel or some clothing. The average incubation period is 2 days to 2 weeks. And first COVID patients in India were 3 students who returned from China to Kerala. This was in January. So what do we mean by outbreaks, epidemics, or pandemics? Outbreak means sudden rise of a particular disease in a small area. Epidemic, the outbreak of the disease in a large area or all over the country. And pandemic means outbreak all over the whole planet. So everyone hears the terms isolation, quarantine, and safe distancing. But what do they mean? Isolation means when an individual who is confirmed positive for the virus infection and they have to separate themselves from healthy people around them. If they are kept in a hospital, it's called isolation. If they are staying at home, it's called self-isolation. And they have to be in isolation until they are free of symptoms or they test negative for the virus. Quarantine means to restrict the movement of people who have come in close contact to the virus or any other infectious disease, but they are negative. So a quarantine will be a person who has come in close contact to a COVID-19 patient, but who has tested negative. But it's ideally for these patients to stay in quarantine for 1 week or 2 weeks until they are sure that they have no symptoms. This is a maximum period of 2 weeks. Then what is social distancing? So to increase physical space between individuals to prevent the spread of the virus. So mainly to avoid public gatherings, stay at home, limit visitors, and stay at a safe distance. Ideally 2 meters away from others. This 2 meters is because of the spread of the virus by droplets from the nose or oral cavities, about 2 meters. Then we have the concept of flattening the curve, that is slowing the virus spread to lower the peak number of cases, hence reducing the burden of the hospitals. So there is a midline where there is the hospitals cannot take the burden of the patients. So you have to bring down the number of patients to below that line. So you see this chart. So how contagious is the coronavirus? You see measles is about spreads to 12 to 18 people, smallpox 5 to 7, whereas INCO is about 1.5 to 2.5. It's not very contagious, but it spreads like each person spreads to 2 people. And here, why is the infectivity of the coronavirus? If you take from day 0, where the patient gets the virus, and the incubation period is about 2 to 14 days. The signs and symptoms start after the 5th day or 6th day, whereas it becomes infectious even before that. From 2nd day or 3rd day, patient becomes infectious up to about 14th day. So even without them knowing they are infected, they can infect to other people. This is the main reason for social distancing. So they are pre-symptomatic but infectious. So how does social distancing help? If one person infects 2.5 people in 5 days, you will have 406 infected in 1 month. So if you reduce it by half, one person infects 1.25 people, you will have 15 people infected in a month. And you reduce it even more by half, one person infects 0.6 people, you have only 2.5 people infected in a month. So the same in 5 days, which will be infected without social distancing, you will have 2.5 people infected in 1 month. So you are reducing the number and flattening the curve. So see this chart, the dotted line is where the healthcare system can treat the patients. Above that line, if there are a number of patients, the healthcare facilities cannot treat those patients. So the aim is to bring the number of patients below that line, that is the flattening of the curve. So few differences between quarantine and self-isolation. Quarantine is for people who do not have the infection, but who have come in close contact with persons with the infection. Self-isolation is who have developed the infection and they can be self-isolated at home or isolated in the hospital. And the time duration for quarantine is 2 weeks and for self-isolation at least 1 week. You see social distancing, people who have not been exposed to the virus, and it's indefinitely. And the main thing is whom you can interact if you are in quarantine or self-isolation. No contact with anyone. You have to stay alone because it's very difficult. Whereas social distancing, you can interact with your family members.
Okay. Thank you, Dr.
The
Iyer.
second part, voting protocols. So because of this COVID-19 situation, hospitals are gearing up to receive a large number of positive patients, and many patients will have acute or emergency problems which require immediate admission, treatment in ICU, or they may need some emergency surgery. So how do hospitals respond? Just brief outline. So because the situation keeps changing day by day and different government guidelines and different rules, the hospital have to prepare for a rapid evolving situation. So as the guideline, as the government orders keep changing, the hospital rules have to change. There may be a change in severity of the COVID patients, so the hospital has to gear up for that too. Developing a clear plan by the higher management, able to communicate that plan to all concerned, and availability of manpower and bringing the healthcare workers to the hospital, availability of medical equipment and implants in an emergency, and most difficult part, availability of blood and blood products. And because nowadays transport is very difficult, so donors find it very tough to go to the hospital to donate blood. So healthcare workers, as Dr. Fabiola has said, will face their biggest challenge from COVID positive patients who may be symptomatic or asymptomatic. So even asymptomatic, you have to be treated as or take care of them as they are COVID positive, and the hospital workers have to be wearing the PPE kit and the mask and gloves. And so this time, it's ideally that elective surgery should not be operated. Should be only emergency or critical ill patients must be managed. So I'll just make my talk into pre-operative, operative, and post-operative care. So before surgery, all patients must be kept in an isolation room, and they must be seen by healthcare workers wearing a PPE kit, including shoes, face mask, and shield, and double gloves. And patients must wear a mask before being shifted to the theatre. Seeing all this, the patients will get very afraid and scared. So the healthcare workers should allay their anxiety and fear and tell them it is for their own safety. And the COVID block, most hospitals nowadays have a separate COVID block where COVID positive patients are treated, and a non-COVID block where the non-COVID negative are treated. Even in the COVID block, there should be 2 theaters for emergency procedures, one especially for obstetrics and antenatal care, because that is the most common emergencies now, and the other theater for other surgical emergencies like obstructed hernia or acute appendix or acute tonsillitis or trauma. So for other procedures, one should be strictly kept for obstetrics cases. And nowadays the guidelines is you should have a negative pressure room with minimal 12 air exchange per hour. And if you have a positive pressure OR, that is the most common, it should be converted to a negative pressure one. An independent provision for AC and humidification, and 2 separate rooms in the OR for donning and doffing your PPE kit. So what we see here is the PPE kit. You have a mask and you have a facial visor, they have shoes, and everyone in the theater wears this. The patient should be having a mask. So in the theater, who should be allowed inside? So the bare minimum only should be inside the theater. Only 2 operators, 2 surgeons, 1 anesthetist, 1 anesthesia technician, 1 sweeper and a nurse, and 1 transfer person. So there should not be many people to keep the minimum number of people in the OT. And again, very important, wearing the PPE kit, very difficult to communicate, to talk, to hear also between the surgeon and the anesthetist, the surgeon and his assistant, and the other team inside the OT. And so they have to previously decide on some sign language to discuss some important things when they want to plan, so when to do what and all that. If there is a lot of oral communication, may be very difficult. So previously agreed sign language, because of the PPE kit, is very difficult to talk as well as hear. And no bag, purse, mobile phone inside the OT. All non-essential equipment should be removed. Most important to remember, there is no spread of coronavirus by blood product transfusion. There is no virus spread in vaginal or breast milk secretion. And always after antenatal care, preferable to do the neonatal care in another room close to the OT. Regarding the surgical procedure must be done as quickly as possible. So the most senior doctor in that hospital should be operating, and preferably regional anesthesia. Avoid unnecessary blood loss. Laparoscopic procedures, the great problem is when you desufflate. When you come out of the laparoscopy, they let the carbon dioxide into the room air. Now this carbon dioxide can have a large number of COVID virus. So the desufflation is very important. They should desufflate into a suction tube and carry the CO2 away from the room. It should not be let. Normally it is let off inside the room itself. And after surgery, there should be a proper plan to quickly remove the patient from the theater and doffing area for the staff. Patient should be covered by plastic sheet and decontaminate and sterilize the theater for minimum 1 hour, including all the walls, all the equipments, and the theater table. So thank you all for the patient listening.
Thank you, Dr. Ayyappan. I think you've couple of questions which I had in mind. What is the difference between isolation and quarantine? The question I would like to ask you now is one, that is, What precautions do healthcare workers take to avoid getting infected with COVID-19 in the OT?
Yeah. So the most important for healthcare workers is they should um, wear the PPE kit first. PPE kit includes double gloves, shoe, shoes, then a whole body suit. Then you have the eye visors, eye glasses, followed by a eye visor. So all that should be there. And the healthcare workers should not touch their face, either the nose or the mouth or the eyes. And they should avoid very close contact and with COVID positive patients. If it is necessary, mostly the anesthetists are having very close contact because they have to intubate the patient while giving general anesthesia. So they keep a plastic shield around the patient and then intubate from quite far away and to avoid the droplets of the patient coming in contact with the face of the anesthetist. So it's very important. And they are donning and wearing the PPE kit and removing the PPE kit should be the correct procedure. Regarding isolation and quarantine, as I told, isolation is for positive patients, but who are asymptomatic and who can be managed at home, that is self-isolation, and who need hospital care, it's isolation in the hospital. Quarantine is for patients who are negative but who are come in close contact with COVID-19 positive patients. Maybe they are close relative or their family member, but they are negative and they are asymptomatic. But these people should be in quarantine for a minimum 2 weeks.
Thank you, Dr. Ivan. Let's now move on to the next eminent speaker, that is Dr. Bavraju Vivekanand, founder and director of Naimisha, a postgraduate in rheumatoid and rheumatology and psychology, master's in healthcare management. Dr. Bavraj Vivekanand is a highly skilled physician with over 17 years in general medicine and psychiatry, with who specializes in geriatrics. He is the founder of Naimisha, a holistic clinic for elder care. Dr. Vivekanand takes great pride in stressing the importance of accepting the changes related to life with a healthy emotional state. The question that he is going to answer for us today is emotional response to corona, and are we all practicing the emotional first aid? Over to you, Dr. Vivek.
Hello, everyone. Thanks for having me on here. Well, as Priscilla had put it across, yes, I'm a practicing doctor, a psychiatrist, geriatrician, and I run Naimisha, which is exclusively for elders. And I'm here today to talk briefly about the need to practice emotional first aid. And I believe this is what will navigate us and help us thrive in these uncertain situations, right? Now, I'm sure you'll all agree with me when I say that this COVID pandemic is an unprecedented, disconcerting time for every one of us. With things being shut down, we don't know when things are going to open up. We don't know how long it's going to last. We need to worry about the health of all the people we care about. Initially, the early reports that started to come in about coronavirus started filtering towards the late 2019. We did not give much attention to it. Not the doctors, not the people. It was only into the early 2020s, March, that the majority of the world population sat up. We started to feel disgust about this. And we felt that the anxieties started creeping into about the situation. And the chorus grew louder. And almost every one of us, I'm sure, had the same thoughts. Will I get it? Should I avoid seeing people? Should I not see elderly relatives? Because there's a whole thing about elders are more susceptible to it. So should I keep my elders away? Should I stockpile on essentials? A lot of people did stockpile, went on this huge binge of stockpiling. Now, this pandemic is, of course, is indeed fueling a fear and anxiety around the world. And sadly, as much as we would like to believe, our minds and our feelings, they're not trustworthy friends that we thought they were. No, our minds are absolutely moody friends that we have. They're very supportive when the going is good, and they're absolutely unpleasant in the next minute. And we have to remember that this is the experience which we get, the anxiety and the fear, and we should benefit to remember if both fear and anxiety have a similar kind of psychological response, right? But they are two different things. Now, fear, if I might quickly explain, is a response to a specific and an imminent danger, while anxiety is response to a very vague, a future threat. And it is here that our emotional response to coronavirus, as I put, they all fall under the anxiety bracket. Now, for many of us, this threat is still uncertain. After so many months, it's still uncertain. It's like an impending cyclone, a storm of what ifs, which is hovering above our head. We don't know if we are going to be exposed to the virus or not. We don't know if you already are. If you are exposed, we do not know if you're going to get the symptoms. If you get the symptoms, we do not know if you're going to recover from them quickly. How long are we going to be isolated? And unfortunately, it's these anxieties that fill on the what ifs, and they fill in with much more unknown and terrifying worst case scenarios that increases our constant stress. Anxiety, by definition, as a psychologist or a psychiatrist, we say that it is a psychological overreaction that can boast uncertain, unlikely, and potentially manageable threats and make it look as if they're incredibly certain and absolutely unmanageable. And sadly, that is not all. This anxiety alone does not keep us in a state of stress. Anxiety fuels in us the feeling of helplessness, powerless. We are overwhelmed and we often feel paralyzed, which in turn increases our vulnerability and makes us sad and less often to take any action. And this point where anxiety makes us not able to take action lies the absolute control. And this is where the key to manage our anxiety is. We need to take control. In these uncertain times, we need to act to restore the very feeling that the anxiety is diminishing, like control, empowerment. We must shut off our fight and flight response, regain a more realistic assessment of the actual threat, and use our emotional, intellectual capacity. I'm sure all of us have that, to deal with the state of stress more effectively. And when we are overwhelmed with such feelings, which come in with an unknown sense of what if is going to happen, we need to start considering adopting self-care strategies. But sadly, all of us, we doctors included, psychiatrists, psychologists included, we give more importance to the physical body than the psychological health. Now that needs to stop. I am not in any way saying physical health is not important, but we have to catch our unhealthy psychological habits and change them. And one of the most unhealthiest of the psychological habits, which I would say, is rumination. To ruminate means to chew over like the what ifs. Think about the upsetting events, and that becomes a habit. We sit and becomes a very costly one, because we sit and we spend so much time focused on upsetting and negative thoughts that we're actually putting ourselves at a definitive risk of anxiety, panic, anger. So having said all this, we need to learn to navigate through this pandemic with courage, hope, empathy. What I would like to say is we must take care of our emotional health, and it's very important. And they didn't manage our stress. But how do we do this? Very simple. I would say I couldn't call it simple, but I would say it's a simple, practical skills which help us cope. I would probably talk about 5 such examples. One, we need to focus on what we do know as opposed to what you don't know. For example, we'll notice that our anxiety is leading to a very what if scenario, which is straight out of our unimaginable hell. And we need to stop it. We need to resist taking the bait. We need to focus instead on facts. Like, we don't know if we will get the virus, but what we do know is people who got virus, almost 90% of them are recovering. People are not suffering, death rate is not so high. We do not know when we will see a beloved person who's somewhere in another country, in UK, in US, Timbuktu even, but we do know that we can get in touch with them with technology. We can FaceTime them, we can video chat them, we can stay connected. Two, we need to think about what's in your control as opposed to what isn't. Very often we feel overwhelmed by what's going on. I would advise we need to take a break, a second, a two, so whatever we're doing, and this will shift the mind from thinking about what's not in our control. Like, we walk into a supermarket. Now we see someone whose mask is not good enough, it's got holes, it's flipped on the nose, who's not wearing gloves. So there's nothing we can do about it. We can sit and worry about him, or we can walk away, ensure our mask is in place, leave the premises as quickly as possible, go back home, sanitize ourselves if we think we've been exposed, and look at it. So this is what we cannot think about. Do not worry about what we cannot manage. We need to focus on what you can do as opposed to what you can't. Whenever we feel powerless, we need to focus on actions that you can take instead of actions that we cannot. For example, many of us must be parents, or we might just be elders who are thinking about how is this whole market financial issue going to affect us, our businesses, or we might have elders at home. But right now, we can sit and stress on them and get more and more anxious, or we can sit down and work together. It could be a housework, or it could be a plan. It could involve children. We would be surprised at what they would come up with a solution for something we have pondered over for such a long time. And by doing so, we are removing the power of helplessness, and we are feeling connected with people. And the fourth point that I was saying is, we need to help ourselves by helping others. When we feel paralyzed by difficult feelings, one way to get unstuck is to help people who are in need. Altruism, by doing significantly, it improves our own well-being. Like, we can check on a neighbor who lives alone. We text a friend who works in a business that has been hit very hard. We can call an elderly family member and just to say hello. Practicing kindness and helping others are great ways to reinforce our own feelings of agency and control. An important feeling that we should use this during stress and potential self-isolation, as we call it. Fifth point I would like to bring across is to reduce or restrict our news consumption. Every one of us, everyone, including me, I'm guilty of switching on the news, reading the papers, looking at stressing, looking at what is happening with the COVID, what is happening around our country, deciding, and this information leads to more stress. We need to balance the time, keep ourselves informed. Yes, that's not, but we should not become overwhelmed by what we are trying to go in through social media. If social media is bombarding us with these things, ignore it, mute the conversation. We need to try to focus on normal activities as much as possible. We need to give our mind and bodies as much opportunities as possible to de-stress and recover, which means we need to take a break from stress-inducing activities. Do read it, do look at news, but keep it at specific hours at the time of the day, and rest of it, leave it. Sixth and lastly, I would say we need to maintain our perspective. Right now, it can be hard for any of us, psychologists included, to see the light at the end of the tunnel. But this emergency situation, it will resolve eventually. We don't know. It could be tomorrow. It could be weeks, years. Optimism. So, but as humans, we are highly adaptable creatures, and life definitely will come back to normal. I mean, the normal might be an entirely new normal, but it will be normal. It is not something that we are now facing and we are seeing confusing. And before I end my brief, I would like to say one very important thing which I notice happening very much among a lot of people is people seem to be confusing social distancing with social isolation. We need to remember that social distancing is not social isolation, because social isolation can become a greater problem. It can lead to loneliness, and loneliness, which in turn contributes to a higher risk of a variety of physical and mental conditions. Being a large, one of the biggest part of being humans is that we are social, and social means to care for others. And caring for others is not spreading the disease. In times like this, the solution, we need to be more very linguistically specific. What is absolutely and clearly needed is physical distancing and not social distancing. Social engagement is desperately needed in pandemic, in during situations like this. And as humans, we are blessed with the ability to be creative. So let's be creative. We have technology, we have advanced so much in technology. So let us use this technology the whole day if we must, but to distance ourselves, to keep ourselves socially active. I think I've just very quickly talked about it. I don't know if I went too fast, but I hope I was able to explain what I was trying to say in a gist.
You did. Yeah. All right. Dr. Vivek, I've had a couple of questions for you, but let me shoot out one question that is very important for the society as such. As world, we are definitely being challenged right now. And so, do you feel we are helpless?
No, we're not. I definitely feel we're not helpless. We probably have lost the plot a little bit, but we can take control. We can take steps. We need to actively manage our emotional health when we are stressed or de-stressed. One of the way, as I said, one of the way we can do is we can communicate with our loved ones. We can stay connected with them. And once we do, we'll notice that we will emerge from this crisis having gained something of a greater value. Something, a true challenge can bestow. We will have an increased resilience, we'll have understanding, and most important, an increased set of empathy. And that, I think, would put us in the not helpless but absolutely empowered category.
Thank you, Dr. Vivek. Now let's move on to our next speaker, Dr. Akila Ayyappan, MBBS DGO, 20 years of experience in gynecology. She has been working on the front line with COVID-affected antenatal and postnatal mothers. Dr. Akila is a part of the public health, and she comes to us to talk about the antenatal and postnatal care and cautions to be looked into during the pandemic. Welcome, Dr. Akila.
Yes. Good evening. Thank you, Dr. Priscilla, for giving me this opportunity to share a few points about the care of the mother during pregnancy and how to make her comfortable and take her throughout the pregnancy and give her a safe baby. So what are the antenatal and postnatal cautions to be taken during this pandemic? And there are generally pregnancy, though we say pregnancy is not a disease, the woman generally have so many queries during pregnancy. They either get the knowledge from the medias or their relatives or friends, and every small thing, though we doctors say it is physiological, nothing to worry, they have their own doubts. More so these doubts will be during this pandemic. Am I going to be affected? Will my child be affected? What will be the outcome if I become COVID positive? So on and on. So we should always take these, we should have a registered with this patients who are having a regular antenatal visit to make them free to call to us and ask their queries as and when they pops up, so that they can have a mental stability, and we should guide them through the pregnancy. Though we generally say pregnancy is immunocompromised state, the chance of these women getting the infection, viral infection is pretty high. They can definitely go through the pregnancy safely. with our guidance and educating them how we can pick up the disease. First, how to prevent the disease of they acquiring the disease. Second, if at all if they get, how do we treat them through the pregnancy? As one of the previous doctors said, the mortality is very less. Though the disease is a pandemic and making us all break our heads, still the mortality is still less only. So we can talk to this patient who might probably fall into the 99% rather than the mortality of 1%. So how do we take them through pregnancy? Routine, any antenatal care, like any other COVID patients, how do we avoid getting the contamination is regular hand washing, sanitizing your hands after touching some objects, then social distancing or the other visiting doctors and physical distancing, and wearing the mask so that you are covering your respiratory tract from anybody who is when there is a droplet infection and you get the infection. The other things in the pregnancy to be highlighted is a nutrition. Any antenatal woman's needs to be educated or counseled regarding the extra nutrition care. She needs extra calories to nurture the baby. So we have to throw more light on the nutrition and give the importance of certain micronutrients, and so that she's having a well-balanced diet, split meal throughout the pregnancy, and to certain medications or certain nutrition which is locally available in our place, so that the immunity is being enhanced so that she doesn't acquire this infection. Hydration. I think all the doctors are talking about this hydration. Any woman needs to be well hydrated during pregnancy, more so in this pandemic period, because if you're going to get an immunocompromised patient which is not hydrated, the more prone she is going for this infection. So as we have thrown light that it's going to affect the respiratory system, we have to teach her breathing exercises. Take a nice pranayamas or tell them that should have a relaxed taking breaths morning, afternoon and evening. Whenever they feel like they can relax and do a small breathing exercise. Rest during pregnancy and comfortable sleep. If they need to have a sleep comfortably, they should be psychologically supported, because the routine antenatal visits is definitely going to be cut down, because we don't want them to expose to the clinics and to come to the hospitals. Means if they come to the hospital, it's not just they're going to come to the hospital. On the way they can acquire some infection. Even if they're supposed to use the own vehicle and come to the hospital, they might acquire infection during the visit to the hospital or during the hospital stay. So we have to have something called telemedicine and give them our number so that they can freely talk to us and minimize the antenatal visits. So every other week they need not come and visit us, and their queries can be dealt with in the telemedicine. We can have a video chat with them and talk to them whatever queries they have. Minimal visits, what we recommend, must visit is 12, 20, 28 and 36 weeks. This is when it is definitely they should come and visit us. I am talking about the normal antenatal women. It should be tailored according to the mother. If she is falling under high risk group per se, if she is having a hypertension or diabetes or anything, we have to make more frequent visits, and she has to come only with one attender, have a face mask, use sanitizer, come in her own vehicle, and we should, before she enters the clinic, all her queries should be answered with either in the telephone or video chatting. And so when she comes to your OPD, you should have minimal conversation with her. So by this, you can avoid the transmission of infection from you to the patient or from the patient to us. So this is how. So when we examine her in your cabin, it should be only clinical examination. The conversation part, she can go back and then prior coming to your OPD, she can ask the questions. So you can have the list of the questions and she can get the clarification prior to come, or you can examine her thoroughly and she can get back, and then you can answer her doubts, whatever she is having. What are the scans absolutely needed is at 12 weeks, and anomaly scan is around 20 weeks, where we definitely want to rule out any life-threatening situation for these babies, any condition which is not going to allow us to continue the pregnancies. What is fetal kick count? So the patients, few decades back, they didn't have so many antenatal pills. All of them had many children. It was not such a big thing to have a regular visit, and suppose if you miss a visit, something big is going to happen. I am talking about the routine antenatal mothers who's not falling under any risk factor. So in these patients, we should educate them what is fetal kick count. They have to have note down when and all the baby kicks. If the baby is going to have a movement, definitely we understand indirectly the baby is healthy. So the patient can be reassured, though you're not having frequent visits, you're going through a normal period of pregnancy. You and your baby are fine. So fetal kick count is they can note down the count. Doesn't mean even if they're sleeping, they should get up from the sleep and have the count come up. Only when they are awake. So for example, over a period of 10 hours, if their count is 10 or 10 hours, it's fairly good. So if they say they usually panic, doctor, in accordance that, it's not moving. I don't know whether my baby is alive because I didn't come and see you last week. What should I do? So like how we are sleeping, the baby also might sleep. So again, counselor and tell her have a small walk or have some food. Your glucose levels might be low so that the baby is not going to move. Even with that, if she's not going to have a movement and all, if she's not perceiving any movements, then maybe she can come and visit you. And once the visit, as I said, you have to tailor the visits, and minimum of 4 visits is mandatory. When they come for that visit, we routinely prescribe iron and calcium tube for the antenatal mothers. So that should be given for, it should be dispensed for 2 months, so that they need not come back just to take the medicines. So what if they get if suppose now as Dr. Ayyappan was telling, every day there is so much difference criteria, whether to screen all the antenatal mothers or whether to screen only those who are from the hot spot or who are having a travel or contact history or with symptoms. So every day we do get guidelines from the government according to the cases which are popping up. Now latest they are saying, last week also we were planning to do, we were doing rather antenatal, all the antenatal mothers were undergoing COVID testing, like say 10 days before their expected days. But we are picking up so much asymptomatic women and putting up a panic situation for either both the doctors and the patients. Again, they are thinking back and asking us whether it is mandatory to do for all the antenatal women, or we should just again go back to do only for the high risk women, so that we may not go and panic the whole lot of mothers. So if they become COVID positive in pregnancy, no panic. Most of the patients are asymptomatic. Only few are symptomatic. If they are symptomatic, means if they have anything like flu-like symptom, they turn temperature and they have shortness of breath, then we call for admission. If they are asymptomatic, but only the routine COVID testing is telling them they are COVID positive, then we have to home quarantine them. It means they have to stay back at home, and so that they isolate themselves from their family members and they concentrate on their diet, the routine antenatal, as I said, hydration, good sleep, and definitely the family support, psychological support, and concentration on taking vitamins, vitamin D3, B12, vitamin C. Elements like zinc, prebiotic will definitely pre and probiotic like yogurt, prebiotic which helps in absorption of this probiotics. These will fight against these viruses. So we have to ask them to take roots like beetroot, carrot, and all that in their home, and educate them what are the symptoms of the well-being of the mother and the baby. Suppose if she's going to suddenly increase her weight, or if she's not going to perceive her movements, or if her COVID symptoms are going to flare up, definitely she should fix up an appointment and come and meet her doctor. So if there is no hard and fast rule, all these medicines, number 1, 2, 3, we have to give, like for malaria, typhoid, we have to give all these medicines. We definitely have to tailor the treatment according to the patient's symptom. So mostly we give a symptomatic treatment. Even if they are symptomatic, we give a paracetamol observer and daily do a saturations, and we have to do a chest x-ray. In antenatal mothers, we routinely don't do x-ray chest, but we can shield. If she's very symptomatic, we can cover the abdomen with a shield and go for a chest x-ray and evaluate her lung if she's having any lung pathology. Or we can give her some antiviral drugs and these supportive vitamins. So if she is a COVID positive patient, so the entire team can have a PPE kit, protect ourselves, and take care of this pregnant woman with a mask. Even if the patient is going to come for the antenatal care clinic, she should definitely wear a mask, and during the delivery and in the OT also, if she's going to be taken up for section. All these COVID patients, definitely they do not warrant a C-section just per se because they are COVID positive. They can, if there is any other indication, then we can go for a C-section. COVID per se is not an indication to go or pushing them to a C-section. We have to monitor both the mother and baby. If anyone needs section for other reasons, then we should be taken up for a C-section. Postnatally, if the patient comes, but she's not routinely done a COVID test, and then she comes in an emergency in early labor or with bleeding. So we should not definitely deny the obstetric care of delivering her just per se because she's not a COVID tested woman. I don't know if should I admit her into my hospital. You take the general precautions, put a PPE kit, as Sir said, you keep a separate OT if you're going to take her up for a C-section, or you can take her into a labor ward and conduct the delivery, whatever is suits her. So we have to protect ourselves and take care of the patient. And during the delivery, she may fall for hypoxia. So it's a multidisciplinary approach. You should alert the team that I'm going to deliver a COVID patient. She might go for hypoxia in between and call the team as and when required. Then after conducting the delivery or performing a C-section, that particular OT or labor room should be disinfected, fumigated, and after, say now the latest consensus, after 1 hour we can start using. How do we take care of this postnatal woman who's COVID positive? We have to again stress on the nutrition. If she is asymptomatic, she can rather ask her to go home, or because she needs a postnatal care, she can stay back in the hospital. Give her a proper nutrition diet, hydrate her, support her with vitamins, and certain antiviral drugs can be given if she's symptomatic. Calcium. Regarding the breastfeeding, will my baby get? See, last week I had a patient which I did a C-section. She came for an emergency with in labor pain, but I had to do a section for the feed baby safe. I just took her COVID test and took her to the theatre and performed a cesarean section. Next day I got the report that she's COVID positive. So I had to isolate the mother from the other postnatal woman, isolate her, and daily do her blood counts. Every second hourly see her saturation. Keep telling her, watching her, continuously monitoring her, putting a separate nurse for her, and monitoring her vitals and saturation, and see if she's going to develop any breathlessness or so. She is very fine. It is almost her 9th day, and she's fine, doing good. So she's so worried. She got the baby after a long period of infertility. So can I breastfeed? Definitely they can continue the feeding to the baby. Same again, the distancing. If it is the mother's choice. If she wants to breastfeed the baby, she can allow to breastfeed the baby. According to WHO, they can continue the breastfeed. It's not excreted in the breastfeed. They can continue the breastfeeding. And the same thing, distancing. If attender is there, they can keep the baby separately at a mere 6 meters difference or 6 feet different distance, and only for feeding the baby can come to the mother. And the mother should take care of the general precautions, using washing her hands thoroughly, repeated washing, using hand sanitizer and all that. So taking care of the mental health is very, very important. Any antenatal woman, even if it's not going to be pandemic, she has 1,001 questions. Am I fine? Am I doing justice to my baby? Am I taking care of the pregnancy? And they keep more so in the pandemic. We should constantly counsel her and support her. We have to educate her if she's going to go in for any complications of pregnancy. Suppose increased weight gain, too much of swelling of the feet, then come to the OPD. If she is having any COVID symptoms also, then we have to evaluate her, because most of the symptoms, it mimics like the small, just a common cold or a flu-like things. We have to differentiate it from COVID and reassure her. And if she needs to be screened by you, she has to come to the OPD and screen. So even though if she's pregnant, the chance of getting COVID is the same risk as the general population. Though we say that she's immunocompromised state, it is the same risk. If she's going to keep her avoiding, personal hygiene, repeated hand washing, and if she's going to wear a mask, going to physical distancing from other contact peoples, she will definitely get the chance of getting the infection is less. More so, if she gets the infection also, she need not panic. She's probably going to be asymptomatic. If she develops symptom, accordingly we have to admit her and take care of her symptomatically, and we can definitely have a safe delivery and give her a healthy, she can have a healthy baby at the end of the day. Thank you. Thank you for giving me this chance. Do you have any queries regarding this?
Yes, Dr. Akila, there is one question I would like to ask. I'd like a brief answer on that. What are the side effects of the treatment of COVID-19 on post?
Hello, I'm not on.
Can you hear me, doctor?
Yeah, once more, please, I didn't get you.
What are the side effects of treatment of COVID-19 on postnatal mothers and the child?
So, for the mothers per se, what are we going to treat her? We are just going to monitor her, give her a symptomatic treatment. The drugs are only vitamins. See, vitamin C is good, doesn't mean she has to go on taking a lot of vitamin C. It's not going to help. Vitamin D, if she's going to, you're asking in the postnatal period, 5,000
yes.
Vitamin D per day, and we can give vitamin C 180 milligrams per day. We should not be too much, over treating the patients. And this antiviral drugs, Tamiflu like drug, what we are giving might cause diarrhea, vomiting. Some may develop skin rashes, and some may go for mood swings. If they are going to develop such side effects, we can withhold this drug and take care of the general measures per se. Regarding the baby, close contact with the mother. So if the mother is not going to wear a mask, not going to, have a hand sanitizer, keep the baby with her itself, the risk of the baby getting, like any other general public, is more. So we have to distance the baby if she's mother is more symptomatic. And when she wants to nurse the baby, we can ask her to use hand sanitizer, then take the baby and feed. If not direct breastfeeding, somebody can help her to express the breast milk, and the baby can be given the express breast milk. So what are the other risks of giving expressed? If she's not going to able to feel, if she's very sick, then you have to give her the other artificial feed, not breastfeeding. Not much of side effects because the treatment per se is not going to, we're not going to bombard them with so much medications.
Okay. Thank you, Dr. Akila.
Yes, Dr. Priscilla.
Sorry, I didn't get that.
See, we are going to just give her vitamins, probiotics, supplementations like zinc, and the antiviral drugs which we are going to give might develop some diarrhea, vomiting, nausea, and all that. If so, accordingly, we have to give the symptomatic treatment. If they develop severe skin reactions or if they get mood swings, then we have to withhold the antiviral drugs.
Oh, thank you. Thank you so much for answering that question. Okay. Now, in conclusion of this panel, I thank each and every one of you all who participated and were there and who did answer the questions and satisfy us. There's one word of thought I'd like to say. Connecting with purpose can help mitigate the resentment that may come along with our current reality. Thank you. This is Dr. Priscilla Dhanaraj. I'm handing this forum over back to Aishwarya.
Yeah. Thank you, doctors, for the enlightening discussion, especially on practical issues faced by frontline workers, pre and post-operative care, and then difference between physical and social distancing, and COVID treatment during pregnancy. These were some which gave us a lot of insights and which clarified our doubts, fears in our minds. So, and definitely Dr. Priscilla for a very lively moderation. Thank you so much.